Okay, good to have you back. It's an amazing time to always share this space with you. So now, with what we have, is HIV a death sentence? Now, what would happen if someone tells you that you are HIV positive? Now, whoever they tell such a thing, I'm not assuming it's you anyway, not you, but if this happens to anybody and they say the person is HIV positive, you can only imagine what that person will be feeling. The person will feel like, oh, my world is crumbling down. Why is this happening to me? But listen up, HIV is not a death sentence. Because you have HIV doesn't mean you're just going to die like instantly. No. Okay, so the only way you can actually get to live like every other human that is not HIV positive is to actually take good care of yourself. There's some things you need to really do to actually suppress the growth of the virus, and then you would actually live like every other human. So now you have to be careful not to do what? Transmit the disease to any other person, because in as much as you're HIV positive, there are some things you need to do to actually stay healthy and to live longer. So the things that actually want to becoming HIV positive. Yes, your guess is as good as mine. So you need to stay away from sex, because you never can tell who is actually HIV infected, so you don't get infected. So that brings us to our topic. We're actually looking at what? Sexually transmitted diseases. So let's go. Now, sexually transmitted diseases. This can either be known as what? STDs or what? STIs. So whichever one you're known or you know it to be called, you're still correct. So it is either sexually transmitted diseases or sexually transmitted infections. Now, let's look at some things you should be able to familiarize yourself with in the course of this class. Now, at the end of the lesson, you should be able to do what? Define sexually transmitted disease, and then you'll be able to explain the causes and prevention of STDs. And also, you'll be able to outline the guidelines for caring for someone that's infected with HIV AIDS, and then you get to know a lot of things too. I know a lot of people have a lot of misconceptions when it has to do with HIV AIDS and HIV AIDS patients, trying to avoid them and all of that. So you're going to be sensitized. You're going to get to know all that is expected of you and how to treat these people right. Okay, now let's move on. Okay, now having to have sex comes with a lot of risk factors. It comes with a lot of risks. So sexual activity comes with a lot of risks, okay? Now you can be infected with diseases that actually come to you because you are engaged in what? Sexual activities. There are a whole lot of sexually transmitted diseases, and HIV is one of them, okay? So we'll be looking at some of these STIs and their symptoms that you would see, or some of them you've not noticed them until you're tested by a doctor to know that you actually have some of these STIs. So let's move on. Now, sexually transmitted diseases. Now, it spreads from one person to another only through sexual intercourse. That's when you have sex with someone. So you don't get STD because you talked with someone. You don't get STD because you shook hands with someone. You don't get STD because you smiled to someone. You don't get STD because you hugged someone. You get STD only because you engaged in unprotected sex and you engaged in sex with someone that is infected with STD. So that's how you get STD. And there are a whole lot of STDs that you can find: chlamydia, syphilis, gonorrhea, the PID, now the pelvic inflammatory disease. Now let's move on to know more about all of these other sexually transmitted disease, the different types of STDs that we have. So we'll be looking at each and every one of them and to know their symptoms as well. Now, the first one we have here is gonorrhea. Now, this is caused by bacterium Neisseria gonorrhea. Now, like we said earlier, you heard the name, sexually transmitted diseases. So you don't get gonorrhea because you hugged someone. You don't get gonorrhea because you shook someone's hand. You don't get gonorrhea because you smiled at someone. The only way you can get gonorrhea is because you got engaged in sexual what? Activity with an infected person. That's the only way you can do what? Get gonorrhea. It is only spread through what? Sexual contact. So, in order not to do what? Get infected with gonorrhea, you know what to do, right? You have to stay away from sex so you don't get infected with gonorrhea. Now, there are some symptoms of gonorrhea that you need to get acquainted with or you need to know about. Now, for the male, the first thing they get to know or notice when they are infected with gonorrhea is that they feel itching and discharge from the penis. Now, they tend to be itchy and there's discharge from the penis. Now, the discharge can be in any color. It could be white, it could be creamish, milkish. Now, this is one of the symptoms that they get to find. And also painful urination. Painful urination. Now, there's something you need to know about symptoms when it comes to male and female. Now, rapidly, the male will tend to actually see the symptoms earlier than the females. I don't know, but that happens. A female could actually be infected, but could manage it and then not actually see the symptoms. But for the male, when they're infected, it's quite fast and rapid. They get to see the symptoms quite earlier than the female. Now, let's move on. So painful urination is another symptom that they would what? Experience. They will get to feel pain when they are urinating. Oh my God. They could scream and people would be like, what's happening here? Yes, that's how it is. So because these are the things that go with having gonorrhea, urinating can be very, very painful. Another symptom of gonorrhea that it causes what? Infertility. Now, infertility is the fact that you will not be able to reproduce. You'll not be able to have your own children and possibly, this is one of the symptoms. So why go through this risk to do what? Having unprotected sex or actually engaging in random sex. Now, gonorrhea could actually cause you not having children. Now, for the women, now if a pregnant woman has gonorrhea, it goes on to affect the unborn child. Now, it could affect the baby's eyes when the baby is born. The baby can become blind. Yes, when a mother is what? Infected with gonorrhea. So it's not just the mother now. It goes on to the unborn child. Another STD that is common and rampant is called syphilis. Syphilis. Now, this also is also caused by bacterium Treponema palladium. Now, yes, those names, I'm sure you two will learn to pronounce this sometime. Now, it is spread through sexual intercourse as well. Like we said, STDs, sexually transmitted disease. So you get to be infected with syphilis because you got engaged with someone that is what? Infected with syphilis. So that is how you get to contact what? Syphilis. It's transmitted through what? Sex. Now let's look at some of the symptoms of syphilis. Now, same thing for the men. They have sores on the organs. They have sores on the organs. Now, you find that there are wounds on the penis. So, in no time, as you're touching, you begin to feel uneasy because of the infection of the syphilis in your body. So, they tend to have sores on their organ. Also, they feel feverish and they have aches, rashes, and hair loss. You could see for these symptoms, you see rashes all over their body. From their head, it's like they're infested with rashes and they feel feverish, they feel ill, and then they tend to lose their hair as well. They lose hair. And also, it can also affect the heart, the eyes, the brain, at later stages if it is not treated. So if this stays in your body for too long without being treated, what could happen would be disastrous and it could lead to what? Death. One can die because you are infected with what? Syphilis. So if it's not treated, after all the symptoms are noticed and it is not treated. Now the funny thing is that you can actually have the symptoms and you're wondering what it is. Now, you can never tell what it is until you do what? You go for a test. And then when you feel this way, you need to go for a test. When you go for a test, that way you'll be able to know what exactly it is. So you don't just start treating randomly, treat this and treat that. And then before you know it, it has got worse than you would have been able to manage. So syphilis can lead to instant death if it's not well treated. Okay, so let's look at this one now. There's always a wrap-up of everything. Now, this STD is one that is so scary. It is the most scariest of them all. Okay? Now, this is acquired immune deficiency syndrome, AIDS. Yes, you heard that right. Now, people talk about AIDS, and then they paint a picture about it. You need to be careful. It doesn't show. People don't carry it, with the label saying I'm HIV or AIDS positive and all of that. They don't say that. They don't carry it. So now, this one is so frightening. And everybody that's going to be involved in unprotected sex should be so scared of this virus because it doesn't show. Like, you can't find it stated on anybody or any individual's face. Now, it is caused by a virus called the immunodeficiency virus, which is what? HIV. Okay? Now, HIV enters into the body and kills the cells of the immune system. So what HIV does is it goes to your cell and then he goes to do what? To just get it all bad. Now, the immune system in humans is what helps the body to do what? Fight against what? Sicknesses and diseases. So what HIV does, it goes to your bank where you are able to, fight in on some diseases. Now, it goes there to make you prone and to make you vulnerable, to make the cells vulnerable, so anything can do what? Infect, affect them. So HIV goes to do what? To infect the cells, the immune system, and makes us vulnerable, so anything can get to them. So when that happens, every little thing that happens to anyone that's HIV positive, you're prone to malaria, you're prone to this, everything. When something is not covered, everything can just come in and out and all of that. So that's what HIV does. It goes to the cell and does what? And causes it to go bad. Kills the cell so it doesn't stay active to fight against some of these diseases or sicknesses that on a normal day could just be fought by these cells and you'll be okay. So it causes it to be bad. Now, people with HIV in their body go on to become sick with AIDS when it is not noticed, when it is not tested. So when you're HIV, doesn't mean you're going to be having AIDS as it is, okay? But when you're HIV positive and then you are tested to be HIV positive, now there's some things you can actually do. We're going to look at that. There's some things you're going to do to stay healthy so it doesn't get to full-blown AIDS. Now, AIDS results in death. That is it's the death sentence, if there's anything to say other than death. So when you have AIDS, when it's full-blown AIDS, the end result is going to be what? Death. That's what happens when one has AIDS. Now let's look at how HIV spreads. How do HIV spread? Now we say HIV is found in the blood and in sexual fluids, the semen in men, and then vaginal secretions in women, okay? Now, let's look at some of these ways in which HIV can be spread. Now, through blood, you can actually get infected or spread HIV to someone through blood. Now, maybe you come in contact with someone's blood or through blood transfusion. Now, this way you can actually do what? Get to be infected with HIV. Now, when we say how HIV spreads, now through semen. Now, for the men, the spermatozoa. And then when a man has sexual contact with a lady, he releases the sperm. So HIV can be found in the cell. And also in vaginal fluids, for the ladies, we have our own vaginal fluid. So it can be found there when you have sex with someone that is infected. Maybe the male has sex with a lady that is infected with HIV. Of course, he's going to be what? HIV positive because of the contact with the fluids from the woman, and also through rectal fluids as well. Now, breast milk is another way HIV can spread from mother to child. So when a woman is HIV positive, in the course of breastfeeding her child, she can actually do what? Transfer this virus to the unborn child. And also pre-seminal what? Fluid, okay, can actually pass on this virus to the other party. Okay, I'm sure you know why and how HIV spreads. Let's move on. Now, how can you prevent being infected with HIV? Ways HIV infection can be prevented. The first things first you need to do is to do what? Abstinence. Abstinence. Now, there's something they say about, there's this thing about AIDS. They say the ABCs of AIDS, the things you need to do. It's like an ABC. The first A is abstinence. You have to abstain, okay? You have to abstain. You have to be faithful. If you're already sexually active, you have to be faithful. You have to stay faithful to a partner. Then C, you have to use a condom if you really need to have sex, okay? You have to use a condom. So now, the first thing first, do not have sex until you get married, okay? Do not have sex. You don't have any business with having sex with anybody until you're married, okay? Then you cannot have sex with your husband. And when you're married, you should do what? You should stay faithful to your partner. Because when you're not faithful and then you go out, possibly the person in which you're going to be having sex with might be infected. And what happens when you get infected? You bring it back home to your wife or your husband. So do not have sex before marriage. Okay, now an uninfected and already sexually active person must have sex only with a mutually faithful partner who is also known to be uninfected. How do you get to know the person is uninfected? It's because you have gone to run a test. You ran a test to be sure that the person is not infected. You can never tell a person is infected because the person doesn't look it. Now, we've seen a lot of handsome looking guys that are actually HIV positive. We've seen a whole lot of pretty girls, very pretty girls that are what? HIV positive. So you never can tell by just looking at people to say, oh, this one looks like he doesn't have HIV. No, you have to get tested to be sure. So maybe possibly you're already sexually active and you need to start having sex, and then you find a partner. You need to be sure that that partner you're finding too is uninfected, does not have HIV/AIDS, and when you find that person, you stick to that person. So don't just go about having random sex with everybody you see. You're going to be prone to having what? HIV. Now, if you really need to have sex, like we said earlier, if you really need to, you need to use a condom. Now, don't forget, condoms are not 100% what? Safe. They are not 100% safe. So some persons have been found to be HIV positive and okay, I used condom. You never can tell if there's a leakage, or in the course of having sex, it could just get torn and then you could be infected. So condoms they don't guarantee you not having HIV/AIDS. So, but if you need to have sex, then you need to use a condom so as to protect yourself. Now, another thing is that do not share sharp objects such as needles, razor blades, and all of that. You can actually prevent being infected by not sharing at all. Let these things be your personal property. Your blades, your needles, your pins, and all of this, your clipper, let them be personal, okay? That way, you're going to be actually preventing yourself from being infected with HIV. Now, another thing is that avoid blood transfusion as much as possible. If there's need not to be transfused with blood, then beautiful. But if you have to be transfused with blood, then you need to be sure that it is well screened and then it is HIV negative and not what? Positive. Now, women with HIV should seek advice before getting pregnant. Now, if a woman is found to be HIV positive and then you want to be having babies, now you need to confide in your doctor, you need to get a test, and then there are ways in which a woman who is HIV positive can actually have a healthy baby who is not HIV positive. Yes, you heard that right. Now, a woman can give birth to an uninfected baby despite she is what? Infected. So if you go to the hospital early and then your doctors know what to do, they know what to do. So they would actually help you have an uninfected baby who's not going to be HIV positive. Now, people that are HIV positive, what should you do to them? Should you neglect them? Should you say, no, I don't want to talk to you, don't come close to me? Now, there are things you need to do with people living with HIV, that are HIV positive. Now, just like we said, we said HIV can be transmitted through sexual contact. Now, HIV is quite different from these other STDs. Gonorrhea cannot be gotten from sharp objects and all of that. It's strictly sex. Syphilis cannot be gotten from sharp objects, blood transfusion, and all of these things. Now, HIV/AIDS is peculiar. Now, HIV can be gotten aside you having sex if you're not being careful. Yes. So this one, sometimes a lot of people have been infected, not because they had sex, but because of carelessness, because of not being very careful. So now, when you find people that are HIV positive, what should you do? The first thing you should do is to provide a home where there's peace, rest, love, and acceptance. You need to love them. You need to make them feel at home. You need to make them feel loved. Okay, I have an opportunity to see someone that is HIV positive, and I have an opportunity to see someone that has been HIV positive for over 10 years and is still very healthy, still living his best life. So now, because of the support system from family, now HIV/AIDS, like we said, is not a death sentence. So when someone is HIV positive, doesn't mean, it is over. No. Now, your love and support can actually make these people live longer than it is expected. Okay, when they feel love, when they feel acceptance, beautiful, they are going to be they'll have the sense of belonging that, it's not over, at least people still love me around, okay? So they will want to have reasons to be around. So another thing is that you should help them eat nutritious food. Now, because this virus is aimed at the immune system, so if your food is not nutritious and your meal is not balanced, you're going to be more prone. So if you are going to be intentional with them, you have to give them foods that are highly nutritious. So it will keep helping to do what? To build the immune system, since the virus attacks the immune system. So you have to keep feeding them with nutritious food so they can be more healthy as the day goes by. Give them love and support, like we said earlier. Give them all the love they need. Support them. If you need you to help them get some things, go to the market for them, cook for them, you can do this. Share their financial burden. Now, when you're HIV positive, it takes a toll on you. You have to spend money. Now, you need to be on drugs, the retroviral drugs. You need to buy them. I remember then, some organizations, actually NGOs, actually give these drugs free, but it's scarce, it's rarely found, okay? Now, for those persons that don't have access to these support system to actually get support for the drugs, these drugs are expensive. So if you can support them financially to get them, because as long as they keep taking their medications, they're going to be here for a long time. So if you can help them with their financial burden, why not? You can support them so they can actually purchase and stay healthy. Then you can pay them regular visits. Don't neglect them. Don't say, no, my constant visit to them can help me, can get me infected. No, not at all. So you can keep visiting them, discussing with them, just relate with them normally, and also nurse them, treat them like babies, treat them like the way you would treat any other person that is sick. Just love them, give them all your support. Okay, so let's move on to the ExamGuide app and look at some questions based on what you have learned today. Okay, So let's look at some questions we've learned today. Let's look at the questions on HIV. I'm sure you would give me your correct answers to these questions. Now, let's look at this one. Human immunodeficiency virus causes, what does it cause? Now we have asthma, we have AIDS, we have epilepsy, we have syphilis, we have gonorrhea. Now what does this virus cause? Is it asthma? Is it AIDS? Is it epilepsy? Syphilis? Gonorrhea? Of course, your guess is as good as mine. It causes what? AIDS. Human immunodeficiency virus causes AIDS. That's what happens. Now, which of the following is transmitted through sexual contacts? Which of the following is transmitted through sexual contact? We have tuberculosis. Now we have gonorrhea, we have typhoid, we have cholera, we have ulcer. Which of these is transmitted through sexual contact? I'm sure you know this. I'm sure you know this. Yes, your guess is as good as mine again. Of course, it is not tuberculosis, it is not typhoid, it is not cholera, and it is not ulcer. Your right answer is what? Gonorrhea. Thank you for participating in today's class. You can practice more questions using the ExamGuide app. Now, the app scores and gives a detailed explanation of all the questions at the end of your practice test. You can learn a particular topic of interest with different modes like the study mode, mock mode, and practice mode. It also has other features that make learning fun. It is a must-have for every serious student. I know you're that serious student. Now you can download the app from www.examguide.com. If you don't have it yet, please do. Now see you in our next class. Don't forget to subscribe to our channel, hit the notification bell, and share the videos to your friends, your family. I'm sure they'll benefit from it as well. Bye for now.